Menopause, that awkward life stage where your body suddenly decides to throw a surprise party and nobody sent you an invitation. One minute, you're scrolling through life like a normal human. The next, your hot flashes are auditioning for a lead role in a sauna commercial, your sleep has ghosted you, and your mood swings are starring in their own soap opera. Yeah, that happened. But here's the thing, post-menopause isn't a death sentence for your confidence, your sex life, or your energy. There are real, science-backed ways to tackle the chaos. Hormones, lifestyle hacks, medical treatments, and yes, a few surprising natural tricks that actually work. So, if your estrogen just hit snooze, your joints are filing complaints, and your brain keeps negotiating with your uterus, stick around. We're diving deep into the best treatments for post-menopausal women. And I promise it's going to be informative, brutally honest, and a little bit fun. Menopause isn't just a change in life stage, it's a full-on hormonal heist. Somewhere between your late 40s and early 50s, estrogen and progesterone quietly pack their bags and leave town, leaving your brain, body, and emotions to deal with the aftermath. FSH and LH, those pituitary hormones, suddenly spike like they just discovered a secret VIP club. And your body? Well, it's left playing catch-up without the instruction manual. Let's talk symptoms, because ignoring them won't make them go away. Hot flashes are the headline act. One minute you're perfectly fine, the next your face feels like it's auditioning for a fireworks show. Night sweats don't get the memo either. They show up in the middle of your sleep like an unwelcome roommate. Then there's the mood swings, which are less normal irritability and more emotional roller coaster, designed by a sadistic engineer. Anxiety, forgetfulness, low libido, and even that mysterious brain fog all make cameo appearances, making everyday life feel like navigating a carnival funhouse. Hormones aren't just numbers on a lab sheet, they're active characters in your life story. Estrogen affects everything from skin elasticity to bone density to serotonin production, which means when it disappears, your emotional stability takes a hit. Progesterone, meanwhile, was the chill roommate keeping your mood and sleep in check. Now it's ghosted, leaving your nervous system in overdrive. And don't forget testosterone, which, while lower than pre-menopause, still influences libido and energy. Post-menopause, it's like a party where half the guests left early and the rest are arguing over the music playlist. Scientifically speaking, these hormonal shifts can also accelerate bone loss, increase cardiovascular risks, and affect metabolic function. But here's the kicker. Each woman experiences this drama differently. One woman's body might act like menopause is a mild office reorganization, while another's feels like an apocalypse of hot flashes and insomnia. Genetics, lifestyle, stress levels, and even prior hormonal health all determine the severity. So, treatment isn't a one-size-fits-all scenario. What works for one woman may do nothing for another, or even backfire. The key is understanding how your own body has responded to this hormonal upheaval and tailoring strategies to support it. That's where lifestyle tweaks, medical interventions, and mental health strategies come in, each addressing different layers of the menopausal maze. In short, menopause is messy, unpredictable, and sometimes rude, but it's not unbeatable. Understanding the hormonal story behind the chaos is the first step in taking back control, because once you know what's driving your body's drama, you can start negotiating like a pro rather than reacting like a passenger on a runaway roller coaster. Before you run to a prescription or herbal supplement, let's talk about the stuff you can control, your daily habits, diet, and movement. Lifestyle interventions aren't glamorous, but they're the unsung heroes of postmenopausal health. Think of them as the friend who shows up with tea and cookies when your hormones are throwing a tantrum. They won't fix everything, but they make the chaos manageable. Diet is the obvious starting point. Post-menopause, your bones start filing complaints thanks to declining estrogen, so calcium and vitamin D are non-negotiable. Dairy, fortified plant milks, leafy greens, and fatty fish become your best friends. Phytoestrogens, found in soy, flaxseed, and chickpeas, can mimic estrogen in the body, giving your system a gentle nudge when it's missing its usual chemical pep talk. And yes, while chocolate doesn't technically count as therapy, a small dose of dark chocolate can still improve mood and provide antioxidants, so don't feel guilty. Exercise is equally critical. Weight-bearing exercises and strength training aren't just for Instagram reels. They actively combat bone density loss. Cardio supports cardiovascular health, which is especially important when estrogen drops, because your risk of heart disease rises. Even something as simple as brisk walking, resistance bands, or Pilates can make your joints and muscles less likely to stage a mutiny. Bonus, exercise also gives your endorphins a shot of confidence, which is exactly what your brain ordered when hot flashes and insomnia are on repeat. Speaking of sleep, postmenopause is notorious for sabotaging your circadian rhythm. Night sweats and insomnia are like uninvited roommates that never leave. Sleep hygiene matters. Keep your bedroom cool, invest in breathable bedding, and establish a wind-down routine. Caffeine and alcohol late in the day? Not ideal. They amplify both heat surges and disrupted sleep. And yes, your phone's blue light might be secretly conspiring with your hormones against you. Stress management is another piece of the puzzle. Elevated cortisol can worsen mood swings, weight gain, and even hot flashes. Mindfulness, breathing exercises, journaling, or even just 10 minutes of uninterrupted quiet time can help calm the nervous system. Think of it as negotiating a truce with your overzealous stress hormones before they grab the steering wheel entirely. Finally, lifestyle changes have ripple effects beyond physical symptoms. They improve emotional resilience. Women who combine exercise, nutrition, sleep hygiene, and stress management report fewer mood swings, less fatigue, and even better libido. It's not a miracle cure, but it gives your body and brain a fighting chance while you decide whether medical or natural treatments might help further. So yeah, postmenopause can feel like a hormonal circus. But establishing solid lifestyle routines is like setting up proper scaffolding. It doesn't stop the walls from shaking, but it keeps them from collapsing entirely. Your body is demanding negotiation and care, and lifestyle interventions are the first, most tangible way to respond. When lifestyle changes aren't enough, it's time to bring in the heavy hitters. Medical treatments. Hormone replacement therapy, or HRT, is the poster child here. And for good reason, it addresses the root hormonal deficit that's causing hot flashes, night sweats, mood swings, and even bone loss. But before you picture it as a magic wand, let's break down what HRT actually does and how it plays in your body. HRT can come in different forms: systemic, pills, patches, gels, or localized, vaginal creams, rings, or tablets. Systemic HRT replenishes estrogen throughout the body, often paired with progesterone if you still have a uterus, to reduce the risk of endometrial hyperplasia. Localized HRT targets vaginal tissues specifically, improving dryness, discomfort during sex, and urinary symptoms, without significantly affecting the rest of your body. It's like sending a targeted rescue team to the problem areas, rather than calling in the full SWAT team. Benefits are clear. Hot flashes and night sweats can decrease by up to 80%. Mood swings may stabilize, sleep improves, and bone density loss slows down, reducing the risk of fractures. Libido often gets a boost too, since estrogen and testosterone both influence sexual desire. For many women, HRT transforms chaos into a tolerable, even manageable, daily rhythm. But yes, there are risks. Cardiovascular complications, blood clots, and certain types of cancer are associated with prolonged or inappropriate HRT use, which is why personalized medical supervision is essential. Age, family history, lifestyle, and current health conditions all factor into whether HRT is right for you. It's not reckless, it's strategic. Your doctor is essentially negotiating with your body on your behalf. For women who want alternatives or complements to HRT, there are options. Selective estrogen receptor modulators, SERMs, mimic estrogen's protective effects on bones without some of the risks for breast or uterine tissue. Bioidentical hormones, chemically identical to what your body produced, are available in creams, gels, or custom compounded forms, though evidence on superiority versus conventional HRT is mixed. Non-hormonal prescription medications, like certain antidepressants or anticonvulsants, have been shown to reduce hot flashes and mood disturbances for those who can't take hormones. Story time. Imagine a woman sitting in her doctor's office weighing HRT against lifestyle changes, with her brain trying to negotiate. Maybe just a tiny patch, please? Her uterus isn't giving out RSVP cards, and her sleep schedule is filing complaints. It's a balancing act of risk, benefit, and personal preference, and that's exactly why professional guidance matters. In short, HRT and related medical treatments don't just mask symptoms. They correct hormonal imbalances that drive post-menopausal challenges. When combined with lifestyle interventions, they can transform what feels like a chaotic hormonal circus into something resembling control. For many women, this is where life post-menopause becomes Not just survivable, but actually enjoyable. Not every woman wants to jump straight into HRT or prescription medications, and that's completely fair. For some, natural and complementary approaches are the first stop, or at least a helpful sidekick in the post-menopausal journey. The trick is separating the science-backed helpers from the hype. Herbal remedies get a lot of attention. Black cohosh, red clover, and evening primrose oil are frequently recommended for hot flashes, mood swings, and general hormonal support. Studies show mixed results. Black cohosh may reduce the frequency and intensity of hot flashes in some women, while red clover might provide a gentle estrogen-like effect. Evening primrose oil is usually pitched for breast tenderness or mood stabilization. The key? These aren't miracle cures, but they can offer a mild, sometimes noticeable improvement without the systemic risks of HRT. And yes, sometimes it's the ritual of taking a tea or tincture that makes a woman feel like she's reclaiming control, which can be just as powerful psychologically as the compound itself. Lifestyle and body-based therapies also have their place. Yoga, Pilates, and Tai Chi can improve flexibility, reduce stress, and support bone and joint health. Acupuncture, for some women, reduces hot flashes and improves sleep, though the evidence is variable. Even simple practices like mindfulness, meditation, or breathing exercises can tone down cortisol, which often spikes when menopause crashes the party. Your nervous system will thank you when it stops feeling like it's permanently on high alert. Then there's diet-based support beyond the basics of calcium and vitamin D. Phytoestrogen-rich foods like soy, lentils, and flaxseed help nudge hormone receptors gently, while omega-3 fatty acids support heart and brain health. Fermented foods and probiotics can help maintain gut health, which indirectly affects estrogen metabolism. Yes, your gut is still gossiping with your hormones. Story-wise, imagine a woman experimenting with an herbal tea ritual every evening. Some nights, she swears the hot flashes are fewer. Other nights, her brain still negotiates with her body like an over-caffeinated lawyer. But the ritual gives her a sense of agency, which is often half the battle in menopause, feeling like she has some control over her body instead of being at its mercy. The bottom line, natural and complementary approaches aren't a replacement for medical guidance when severe symptoms or risks are involved, but they are a valuable tool in the toolbox. They provide mild symptom relief, improve overall well-being, and give women a sense of empowerment. And when combined strategically with lifestyle interventions, or even alongside HRT, they can enhance comfort and confidence, turning menopause from a crisis into a managed transition. Post-menopause isn't just a hormonal roller coaster, it's an emotional one too. As estrogen and progesterone dip, neurotransmitters like serotonin and dopamine follow suit, which can make even small stressors feel like major betrayals. Anxiety, low mood, irritability, and brain fog aren't signs of weakness. They're physiological consequences of a shifting internal environment. Her brain didn't refuse to cooperate for fun. It's reacting to a chemical rebellion. Depression rates can increase during and after menopause, even in women who have never experienced it before. Night sweats and insomnia exacerbate the problem, leaving the body exhausted and the mind less resilient. Cognitive shifts are also common. Attention, memory, and multitasking can feel compromised, like her brain's operating system is running updates in the middle of a crisis. These changes can trigger frustration, self-doubt, or social withdrawal, which then loops back and worsens emotional symptoms, a vicious, sneaky cycle. Therapy can be a lifesaver here. Cognitive behavioral therapy, CBT, has been shown to help with both mood and hot flashes, teaching women to respond to stress and physical discomfort with strategies that actually work rather than reactive panic. Mindfulness and meditation similarly provide tools to calm the nervous system, reducing the intensity of hot flashes, irritability, and racing thoughts. Support groups are another underrated resource. Sharing experiences validates feelings, reduces isolation, and often produces practical tips that science hasn't yet studied. Self-image challenges also emerge post-menopause. Changes in weight distribution, skin elasticity, hair thinning, or libido can make women hyper-aware of how they look and perform sexually. Hormonal changes don't just affect the body. They affect confidence and social engagement. Humor, perspective, and self-compassion become important tools. Picture her confidence refusing to RSVP to the party her body is hosting. Acknowledge it, work with it, and find ways to make the party enjoyable anyway. Small, consistent strategies often make the biggest difference. Structured routines, physical activity, journaling, social engagement, and creative outlets. Exercise alone improves mood, memory, and sleep, while also reducing cardiovascular risk. Mental health care, whether through professional therapy, peer support, or daily coping techniques, reinforces the benefits of lifestyle changes and medical treatments. Essentially, supporting mental health is like providing emotional scaffolding. Without it, all other interventions are fighting an uphill battle. Ultimately, post-menopause mental well-being isn't optional, it's central. Ignoring it isn't toughing it out. It's risking a cascade of symptoms that make the physical and emotional aspects of menopause far harder to manage. Addressing emotional health alongside physical treatments creates a synergistic effect, giving women the best shot at reclaiming energy, confidence, and joy during this life stage. By this point, it's clear that menopause isn't a uniform experience. The combination of symptoms, hormonal shifts, personal health history, and lifestyle creates a unique profile for every woman. That's why personalized treatment isn't just a recommendation, it's essential. What works wonders for one woman might do nothing for another, or worse, make her feel like her body is staging a revolt. Consider HRT. Some women see dramatic relief from hot flashes, night sweats, and mood swings, while others notice minimal difference or encounter side effects that make the treatment more trouble than it's worth. Similarly, natural remedies like black cohosh or red clover can be life-changing for one person and utterly ineffective for the next. Even lifestyle interventions vary. Strength training might reinvigorate one woman's energy and confidence, while another sees improvements only in sleep quality, with mood swings still stubbornly lingering. The first step in personalizing treatment is awareness. Tracking symptoms, cycles, sleep patterns, and emotional fluctuations provides concrete data rather than relying on vague impressions. A journal or digital app can reveal patterns, like noticing that hot flashes spike on stressful days, or that mood dips coincide with nights of poor sleep. With this insight, women can experiment with adjustments systematically, seeing what combination of interventions works best for their body. Professional guidance is crucial. A gynecologist, endocrinologist, or menopause specialist can interpret lab results, assess risks, and recommend tailored treatment plans. This might involve HRT, SERMS, bioidentical hormones, non-hormonal medications, or a mix of lifestyle and complementary therapies. Women also need to consider personal risk factors, family history of cardiovascular disease or cancer, bone density, and even mental health history, to make safe, informed decisions. Story-driven examples help illustrate why one-size-fits-all fails. Imagine 3 women. One finds nightly meditation and dietary phytoestrogens drastically reduce her hot flashes. Another thrives on HRT with weekly strength training. And the third combines bioidentical hormones with acupuncture and therapy to stabilize mood. Each path is valid because it respects the individuality of the body and the mind. No two hormonal rebellions are alike. Finally, personalized treatment isn't static, it's iterative. Symptoms evolve, risk factors change, and life circumstances shift. Staying proactive, monitoring changes, and maintaining open communication with healthcare providers ensures the treatment plan grows with the woman. Menopause becomes less a crisis and more a managed transition, a phase where knowledge, strategy, and self-awareness allow women to regain control over their bodies, their confidence, and their quality of life. Personalization is empowerment. It's negotiating with your body like a skilled diplomat, rather than reacting like a hostage. The result? Better symptom management, improved well-being, and a renewed sense of agency in a phase that too often feels uncontrollable. Post-menopause doesn't have to be a daily battle against your own body. Between lifestyle interventions, medical treatments like HRT, natural and complementary approaches, and a strong focus on mental health, women have more tools than ever to reclaim comfort, confidence, and control. The key takeaway? There is no universal solution. Understanding your body, tracking your symptoms, and working with healthcare professionals lets you craft a personalized plan that actually works for you. This is your invitation to engage. Comment below with your experiences, frustrations, and victories during post-menopause. I personally read and respond to your stories because your journey matters, and sharing it can help other women realize they're not navigating this alone. Don't forget to like, share, and most importantly, subscribe to the channel. This cannot be stressed enough. The next video will dig even deeper, revealing the secret ways your body continues to change after menopause and what no one tells you about keeping your energy, libido, and mood on track. Remember, menopause isn't the end. It's just a new chapter, and with the right strategies, you can write it on your terms.